Hello everyone, I'm Dr. Monica. Today's video will be on mandibular nerve. So mandibular nerve, it is the third and the largest branch of the trigeminal nerve. So this nerve, it is a mixed nerve, meaning that it has both sensory and motor sensation. It supplies sensation to the lower face, lower teeth and part of the tongue, and it gives motor innervation to the muscles of mastication. So let's walk through the course of the mandibular nerve. We begin in the pons, that is the brain stem, where the motor nucleus of the trigeminal nerve is located. So this is important because the third branch of the trigeminal nerve, it is the only division that carries motor fibers in addition to the sensory fibers. From here, the nerve fibers, they will connect with the trigeminal ganglion, which contains the sensory cell bodies. Next, the motor and the sensory root, they combine to form the mandibular nerve. So the newly formed mandibular nerve then exits the skull through the foramen ovale and it enters the infratemporal fossa, which is an important anatomical space below the base of the skull. So at this point, the mandibular nerve, it forms a short trunk that gives branches, that is meningeal branch, and we have the nerve to medial pterygoid. So after these branches, the mandibular nerve, it gives two divisions, that is we have one anterior division which is mainly motor and the second one is posterior division which is mainly sensory. So let's talk about the main trunk of the mandibular nerve. We have two branches. The first one is meningeal branch of mandibular nerve, which is sensory in nature and it supplies the dura mater of the middle cranial fossa. Coming to the second branch, that is the nerve to medial pterygoid, which is motor in nature and it supplies the medial pterygoid muscle. Also, the tensor villi palatini and tensor tympani are supplied by it. So let's talk about the anterior division of the mandibular nerve, which is mainly motor, but it is sensory to the buccal nerve. So let's talk about the branches. So coming to the first branch, that is the masseteric nerve, it supplies the masseter muscle. Next one is the deep temporal nerve, it supplies the temporalis muscle. Next we have is the lateral pterygoid nerve. It supplies the lateral pterygoid muscle. Next we have the buccal nerve which is sensory to the cheek and the buccal gingiva. So now let's talk about the posterior division of the mandibular nerve which is mainly sensory in nature. So the first branch, that is the auriculotemporal nerve, it provides sensation to the ear and the temporal region. The second branch, which is the lingual nerve, it provides general sensation from the anterior two-thirds of the tongue. Coming to the next branch, that is the inferior alveolar nerve, it provides sensation to the mandibular teeth, chin and the lower lip. And the motor sensation, it is provided to the mylohyoid and the anterior belly of digastric. So talking about the motor fibers of the mandibular nerve, it supplies the muscles of mastication, that is the masseter muscle, the temporalis muscle, the medial pterygoid and the lateral pterygoid muscle. Also it supplies the mylohyoid muscle, anterior belly of digastric, along with tensor villi palatini and tensor tympani. So let's talk about the blood supply of the mandibular nerve. So the main artery which supplies the mandibular nerve is the maxillary artery. So let's first begin with the intracranial part, that is near the foramen ovale. In this region, the blood supply comes from the middle meningeal artery and the accessory meningeal artery. And both these arteries, they provide vascular support to the root of the mandibular nerve as it lies near the foramen ovale inside the cranial cavity. So coming to the second part, that is the infratemporal fossa. Once the mandibular nerve enters the infratemporal fossa, it is accompanied by several branches of the maxillary artery. That is, first one is the inferior alveolar artery, which travels with the inferior alveolar nerve into the mandibular canal and it supplies the lower teeth. Next we have is the muscular branch, which includes the deep mesenteric temporal arteries that supply the deep temporal nerves and the masseteric nerve. Then the third artery is the buccal artery, which along with the long buccal nerve supplies the cheek region. So now let's talk about the clinical significance of mandibular nerve in dentistry. First one is the inferior alveolar nerve block. So this is a common dental anesthesia for the mandibular teeth. Second one is during the lingual nerve injury, there is loss of tongue sensation. Third is whenever there is damage to the inferior alveolar nerve, there will be numbness of the lower lip and chin. And the TMJ pain, it may involve the auriculotemporal nerve. If you have liked the content, please like, share, and do subscribe to this channel. Thank you.